Chapter 24, Fungal Infections of the Skin, a review from class in the Lewis textbook. Candidiasis is a common infection in people who have a weakened immune system as well as a common hospital-acquired nosocomial infection. The fungi grow in damaged skin and can spread through the bloodstream to cause infection throughout the body. Candida lives on the body without normally causing disease, but it can cause infection when it enters the bloodstream through the digestive tract. It can also be transmitted through contaminated medical equipment. The picture on the left is consistent with an oral Candidus thrust infection, which can occur in patients who are taking medication such as immunosuppressants or antibiotics. Candidiasis is not associated with poor oral hygiene or lower respiratory infection. Other skin rashes emerge in moist, warm areas of the skin, like vaginal yeast infections. Diagnosis is based primarily on clinical observations and patient history and maybe a KOH preparation. Cultures can help support the diagnosis. A tryptan blue stain is a new method for rapid diagnosis. Medical management is basic hygiene and topical nystatin powder, clotrimazole or miconazole. It is indicated in all patients as first-line therapy. Patients should try to keep their skin dry and apply antifungal preparations twice daily or as directed. Oral fluconazole may be indicated in moderate to severe disease. Tinea Corporis is a superficial dermaphyte infection characterized by either inflammatory or non-inflammatory lesions on the skin regions except the scalp, groin, palms, and sole. The medical management is topical antifungal, and that's a first-line therapy, and it's usually taken twice a day for about 30 days. Systemic griseofulvin is indicated if topical antifungals are ineffective. Tinea Corporis is also known as jock itch and occurs in the groin area. Medical management is a topical antifungal and it's indicated as a first-line therapy, usually taken twice a day for 30 days. If topical antifungals are ineffective, then systemic griseofulvin can be given. Tinea Pedis is a term used for infection of the soles of the feet and the interdigital spaces. Medical management is pretty much the same as the Tinea Corporis. Topical antifungal, twice a day for 30 days, and systemic griseofulvin if the topical antifungals are ineffective. Tinea Capitis, or ringworm on the scalp, is a common fungal infection, especially in children. The main way it's transmitted is by coming in contact with an infected person or animal. Diagnosis is based on clinical observations, such as histology with KOH preparation or Woods lamp evaluation. Medical management is that oral antifungals such as terbinafine, fluconazole, itraconazole, and griseofulvin should be used to treat Tinea Capitis. Tinea Versicolor is a common benign superficial cutaneous fungal infection usually characterized by hypopigmented or hyperpigmented macules and patches on the chest and the back. In patients with a predisposition, Tinea Versicolor may chronically recur. The fungal infection is localized to the stratum corneum. Medical management is topical antifungal agents, and it's indicated for the first-line treatment. Selenium sulfide shampoo for 7 days, followed by weekly prophylaxis. Systemic antifungals are only indicated when the topical antifungals are ineffective.